Hi, my name is Sophia Aguilar, and for my second project, I'll be doing strengthening the hip of a dancer. My client name is Emma Aguilar, who's been dancing for about 6 years, and lately she's been feeling weaker and unstable in her hips, and she's been wanting to straighten her hips. And this is important for a dancer to straighten their hips because dancers put a lot of pressure on their hips while performing, since they do a lot of twisting, turning, and swinging movements. And I decided to create a 2 week program for 4 days a week that targets the hip muscles. And before we get started with the exercises, we need to learn about the hip anatomy and the focus points. So the hip consists of the gluteus and the hamstring muscles, which are the bicep femoris, semitendinosus, and semibraniosus, and the adductor magnus muscles, which supports the gluteus maximus. Dancers mainly use the glutes while dancing since it is responsible for extension, abduction, internal rotation, and internal rotation. But the hamstring muscles and the magnus also are responsible for flexion, extension, abduction, adduction, external rotation, internal rotation, and circumduction. And this is important for a dancer because in order to maintain alignment and improve position stability, a dancer must have muscular strength, which provides support for the joints, so the dancer can hold the pose for a longer period of time. For my baseline testing, I decided to do abductor sideline, which targets the inner thigh muscles, and you're supposed to time your client for 1 minute and see how many they can do up and down. And for my first time, a client was struggling a bit and was shaky while doing it, and she only was able to do 15 for a minute. For the workouts, you're supposed to do 15 reps for 3 sets, or a minute hold, but still 3 sets. And for my first one, single legged Romanian deadlifts, this increased hamstrings and glutes. It also reinforced proper hamstring engagement, and it also improves balances and it strengthens the cores. Threading the needle, this pose stretches your glutes and hips. 4 point kneeling, it targets the external muscles, and this can also be used for endurance. And if this was a little bit too easy for your client, then you should have them move their hips slightly side to side a little bit and have them tighten their core a little bit more. For monster wobbles, this straightens the hip abductors. And if this is a little bit too easy for your client, you can also tighten the resistance band. The clamshell, you're supposed to do a 1 minute hold, and this helps straighten the gluteus medius, which also helps with balance muscular effort between the inner and outer thighs and the pelvic. And the ilias psoas resistance band, you're supposed to hold the leg at a 90-degree angle and slightly move it back and forth, or hold that position at a 90 degree for a little bit. And this is to help the IT band and reduce tightness. Result: my client had a slight increase in her hip strength, and from her first time of doing the sideline abductors, she only did 15, and after the end of the 2 week program, she did 30. And um, before she was a little bit shaky, and after she was a little bit less shaky, but I saw that she like did it a little bit too fast, so I also like told her to slow down and made her restart every time she went a little bit way too fast in her normal pace. But yeah, that's my program, and this program isn't just for dancers. This is for anyone who wants to increase their hip strength and want to feel stronger and more stable in their mobility in holding their hip position for a longer time, or just having that securance in hip strength.